When you dream about becoming a doctor, what do you see? Is it a vision of building lifetime relationships with patients? Does it include being described as a member of the family by your patient and as a trusted source of knowledge and compassion by your neighbors?
Being a primary care physician is more than just handing somebody their medication or fixing some ailment and then never seeing the patient again. I think it's being part of that journey called life with that person and being there through their good health, through their bad health, through family emergencies, through their successes.
I like the fact that I could get to know brother, sister, mom, dad, grandmother, maybe future child. To me, that is important. That's meaningful to me. I like, developing relationships with people.
With my future patients, I hope that I can form a real connection with them. I hope they see me as more than just a doctor to them. I hope they can see me as a friend or someone that they can go to and count on.
At Geisinger, we share the same dream. We know primary care is the key to better health for all. We know that primary care doctors make it easier for patients to grow and stay healthy. Geisinger supports the ideals of its future doctors in an environment that places primary care where it belongs, at the forefront, and is the leading concern of every innovation and technological advance that happens within Geisinger's walls.
Primary care is never going to go away. At the end of the day, I've always said when a patient or a family member is stressed by some illness or concern about a symptom, they really want to have a true relationship with another person that they trust.
When I think about when I started 22 years ago, it was mostly up to the physician to get everything done for the patient. Now we have such a care team around the patients.
At Geisinger, the tools at our physicians' disposal are the epitome of modern. As a Geisinger primary care doctor, you will have the opportunity to practice 21st century medicine at every step.
Geisinger is innovating in a number of ways in primary care. 65 Forward, Geisinger at Home, primary care redesign, fresh food pharmacy, the list goes on. We're going to be educating the next generation of physicians to expect that this is the way that primary care should happen.
Primary care redesign focuses on team-based care, population identification, and risk stratification, while incorporating analytic support and electronic medical record solutions. The goal is a stronger doctor-patient bond and better care.
The primary care redesign really put the structure behind the support that's needed for primary care, for the providers and for our patients. So for students that are coming out and going into primary care, it provides them with a level of support that really is not seen many places across the country.
I really want to be able to give back to the community. People from my hometown are always like, oh, are you going to be our doctor when you're older? And I know that they're joking with me, but it is that you can just tell from within the community that there is a need.
I think everyone deserves a great doctor. Hopefully I could be one that can provide to this area.
If you're looking for a challenge and you always want to learn, this is the field that you should come in.
If your goal in going to medical school is to be a primary care physician and to make a difference in the lives of your patients the way nobody but their primary care doctor does, and if your view of medicine is that you should not just be managing disease after it happens, but that you want to promote health of your individual patients, of communities in general, then I think there's no better place to come than Geisinger Commonwealth School of Medicine.